Hello everyone, welcome back to Comment Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page and the link will be given in the description. Today we are back with another communicable disease and we shall discuss measles or rubella, which is one of the most common respiratory infections among children. So, measles is caused by a virus, and the measles virus is known to be one of the most contagious virus or agent to cause disease among human population. This virus is exclusive for human population and it does not cause the disease among animals. Also, no animal reservoir or vectors are known to occur. When this virus is introduced in a population which is not protected or immune against the disease, it is expected that almost 100% and some authors says more than 90% of that particular population will become infected and they will show the clinical features of the disease. Measles is endemic in almost all parts of the world, but in developing countries like India, it is associated with high morbidity as well as high death rate. As per the measles and rubella initiative record, the disease kills almost 380 people, most of whom are children, every day, and it infects over 6 million people every year. If a person is infected and has the disease, then the person is expected to spread infection to 10 other people, and that shows how much contagious this virus is. With introduction of measles vaccination, there has been a significant drop from 2000 and to 2018 in measles death rate. Now, a few programmatic definitions in context of measles. First one is the measles elimination, which is the absence of endemic measles transmission in a defined geographical area, which can be a region or even a country, for 12 months or more in the presence of a well-performing surveillance system. So, first of all, we need to have a well-performing surveillance system which will be able to detect any transmission in the defined geographical area, if any. Now, if such surveillance system cannot detect any transmission because there is no transmission for a period not less than 1 year, so it says 12 months or more, then we can say that geographical area has eliminated measles. When the same thing occurs at a global scale and also for an indefinite period of time, not only more than 12 months, then it is known as measles eradication. So, worldwide interruption of measles virus transmission in the presence of a well-performing surveillance system. So, that is why this is all or none phenomenon. So, either it occurs or it does not occur. Now, coming to the agent factors. So, measles is caused by a virus which is a RNA virus. The name is paramyxovirus. Source of infection is a case of measles and carriers do not occur in measles. This is very important for MCQ. In measles, we do not have any carrier. Infective materials are mostly the secretions of nose, throat or respiratory tract of a case of measles, either during the prodromal period or during the early stage of the rash. Communicability, that means when the person spreads the infection to others. So, 4 days before the appearance of rash, so whenever the ash appears, 4 days before that, the person starts spreading infection, and 4 days after appearance of rash, up to that period, the person will keep spreading the infections. So, the communicability is from 4 days before to 4 days after the appearance of rash. Host factor, now it actually can affect all age group, but the children are highly susceptible. So, infancy and childhood, that is 6 months to up to 3 years in developing countries like India, whereas in developed countries where the vaccine coverage is very good for the children, 5 years and above age group is at risk. Gender equal, as it means both males and females are equally susceptible. Immunity, maternal antibody can protect the child up to 6 months of age. After that, the child is susceptible to develop the disease. And if a person is infected with measles and has the disease, then the disease will confer him lifelong immunity. So one attack of measles confers lifelong immunity, and that is why second attack is not common. That means a person once who had the disease of measles, he will not develop measles again. Nutrition, it tends to be very severe in malnourished children. So those children who are undernourished, by malnourished I mean mainly undernourished, these children are at very high risk of developing the disease, and if they develop the disease, the severity is quite high. Environmental factors. So in areas with tropical climate like our country, most of the cases of measles occur during the dry season, and in the areas where temperate climates, the peak occurs during the late winter and early spring. Also, people living in congested area, for example overcrowded slums, etc., that means people belonging to the poor socioeconomic status, they are at high risk. Person to person transmission can occur by droplet infection or droplet nuclei, and we also already discussed the period of communicability, which is 4 days before the appearance of rash up to 4 days after the appearance of rash. A child who has received the vaccine is not contagious to others. Since this is a respiratory infection, so the portal of entry most commonly is the respiratory tract, but very rarely it can also be the conjunctiva. Incubation period, which means the time gap between the infection and the onset of symptom. Most of the children would come with complaint of fever, so that is their first symptom. So in that case, the incubation period is 10 days. But there are many children who do not show any fever, rather in them the first sign is the rash. For them, the incubation period is a little bit prolonged and it can be 14 days. Clinical features. So measles have different stages like prodromal or pre-eruptive stage, eruptive stage, and post-measles stage. First, the prodromal or pre-eruptive stage. So it occurs 10 days after the infection and lasts up to day 14. Lot of children, as I already mentioned, would come to us with complaint of fever. Along with that, there can be coryza with sneezing and nasal discharge. So cold, that means there is running nose, sneezing, nasal discharge, etc. And there can be cough, redness of the eyes, so conjunctival congestion can be there, lacrimation, and often photophobia. There can be vomiting and diarrhea also. Now something known as Koplik spot is pathognomonic of measles, which are bluish white spots on a red base, and they are very small, smaller than head of pin, and they appear on the buccal mucosa opposite to the first and second lower molars a day or two before the appearance of rash. So Koplik spot appears before the appearance of rash, about 2 days before the appearance of rash. So as you can see, this is the lower molar teeth, probably molar 1 and molar 2, and opposite to that we have this Koplik spot. These things, these white spots are the Koplik spots here also. Next, the eruptive stage, that is the stage of rash. So these rash are dusky red in color, they are macular or maculopapular in nature. Now these rashes appear behind the ear and then spreads rapidly in few hours over the face and neck and extend down to the body, taking 2 to 3 days to progress to the lower extremities. So this is a very important difference between the rash of measles and the rash of chickenpox. In chickenpox, the rash first appears on the trunk, on our body, then it spreads towards the extremities and also towards the head and neck. So it spreads outward. Here in measles, the rash first appears behind the ears and then it spreads rapidly over the face and neck and then towards the body. So it goes downwards, and in another 2 to 3 days it also is present on the lower extremities. The rash may remain discrete, that means individual rashes can be identified, but often they become confluent and blotchy. So these rashes merge with each other and it is very difficult to identify the individual rash separately. If there is no complication from the disease, the lesion, that means the rashes and the fever, disappear in another 3 to 4 days, which signals that the disease is now complete. The disease cycle is complete, but sometimes in presence of complication, it can also last for a longer period of time. The patients normally improve by 3rd day of rash and recover fully 7 to 10 days from the onset of the disease. So this is a picture of measles rash. So as you can see, most of the places the rashes have merged. So they are confluent in nature. Here also, here lot of places you can see the rashes have merged with each other. So individual rashes can be identified at some places here, like here, etc., etc., but in most of the places they are confluent. Now diagnosis is based on clinical finding. So based on typical rash, as well as you have to take the history of the patient and Koplik spot, which is pathognomonic of the disease. But in developed countries where measles is quite uncommon, they go for some diagnostic tests which are confirmatory. For example, specific immunoglobulin antibody detected by ELISA, or even detection of viral RNA by RT-PCR, that is real-time polymerase chain reaction. Post-measles stage is characterized by loss of weight, there can be weakness, growth retardation in children, diarrhea, cancrum oris, pyogenic infections, candidosis or candidiasis, and reactivation of pulmonary tuberculosis. Complications: there is high risk of complication in children less than 5 years of age. Also, people living in overcrowded condition, because most of the time their level of immunity is quite low, malnourished, especially vitamin A deficiency, and also those with immunological disorders such as AIDS. So any immunosuppression, in that case there can be complications. The most common complications are otitis media, laryngotracheobronchitis, also known as croup, diarrheal with protein losing enteropathy, and pneumonia. And some of the rare complications include post-infectious measles encephalitis and subacute sclerosing panencephalitis, known as SSPE. Measles during pregnancy is not known to cause congenital abnormality. So congenital malformation does not occur from measles during pregnancy, but there have been cases of spontaneous abortion or premature delivery reported where there was measles during pregnancy. It is recommended that the infants born to such mothers be passively immunized with immunoglobulin at birth. So we shall talk about passive immunization with immunoglobulin, and those children who are born to mothers who had measles during pregnancy should receive immunoglobulin. There is no specific treatment for measles, but whenever we come across a patient, we should provide supportive care like relieving common symptoms, for example fever, cough, cold, sore mouth, conjunctival congestion, etc. And we should also provide nutritional support to reduce the chance of malnutrition. Following measles, acute vitamin A deficiency is very common and it can lead to keratomalacia, which is liquefaction of eye, or maybe blindness from corneal scarring. To prevent that, high dose of vitamin A is given, and these doses are based on the age of the patient. Now, 2 doses are mandatory, that is on day 1, that is immediately on diagnosis, and the second dose on the next day. After 4 to 6 weeks, we assess the patient again, and if there is any clinical sign or ocular manifestation of vitamin A deficiency like bitter spot, in that case the 3rd dose can be given. The age specific daily doses are 50,000 international unit for infants less than 6 months. 1 lakh international unit for infants aged 6 to 11 months, and any child more than 1 year of age should receive 2 lakh international unit. Coming to prevention, which can be done by active immunization by vaccination or maybe by passive immunization with immunoglobulin. Now there are different types of measles vaccine. One is monovalent vaccine, which is measles only vaccine, or it can be measles containing vaccine. For example, MR or measles rubella vaccine, MMR or measles mumps rubella vaccine, or MMRV, that is measles mumps rubella and varicella vaccine. They are live attenuated vaccine, and each dose of 0.5 ml, which is the dose for vaccination, contains more than 1000 viral infective units of the vaccine strain. So the schedule, according to National Immunization Schedule, 2 doses are to be given. First dose between 9 to 12 months, but preferably at 9 months, and dose 2 at 16 to 24 months, preferably at 18 months. Route is subcutaneous and site is right upper arm. Dose is 0.5 ml. Adverse effect, very uncommon, other than fever, local induration, and maybe measles like illness. There is another very serious adverse effect, which is toxic shock syndrome. It occurs from contamination of the vial. That is why vaccine should not be used after 4 hours of opening the vial. There can be severe watery diarrhea, vomiting, high fever, and also death can occur within 48 hours. In certain situations, measles vaccination is contraindicated. For example, a person infected with HIV having severe immunosuppression, or people having moderate or severe acute illness, they should not receive the vaccine. Also, pregnant women should not receive the vaccine. Immunoglobulin is a mean of providing passive immunization. So basically we are providing the ready-made antibody. This is to be given within 3 to 4 days of exposure. Suppose in a village a child is diagnosed to have measles. So since he is infected, he will have natural protection against it. But all the other children who came in close contact with this particular case, maybe they were playing together, maybe they went to the school together. So all these susceptible children who have not received the vaccine yet, they should be given the immunoglobulin. The dose is 0.25 ml per kg body weight according to WHO recommendation. Also, these children who are given the immunoglobulin or the passive immunization, they should receive the measles vaccine 8 to 12 weeks later. Now remember, since in passive immunization we are providing ready-made antibody in the form of immunoglobulin, this protection is only temporary, it is not lifelong. So that is why these children can be exposed again and can develop the disease again. This is why these children should also receive the vaccine, provided they have not received the vaccines already. Now there are certain factors which we can consider in context of measles eradication, because these are the favorable factors which can help us to eradicate the measles. First is, there is only one antigenic type of the measles virus. So there are not many different antigenic variation, there is only one antigenic type. These virus do not survive much long in the environment. So that is another good thing. One attack confers lifelong immunity. So if a person has the disease or have had the disease in past, he will be protected lifelong. There is no animal reservoir and man is the only natural host. This virus is not present in the animal population. Also, animals are not affected. Measles are not known to occur among animals. Source of infection is a case, most of the time the clinical cases, and there is no carrier present in measles. And also highly effective vaccines are available. So the vaccines we give under National Immunization Schedule, they have very high protection. Considering all these points, maybe in future we will be able to eliminate measles in different parts of the world and maybe finally eradicate measles from the whole world. So with this, we conclude today's session on measles. If you like our video, please subscribe to our channel and share this video with your batchmates, with your juniors, and also with your friends from other colleges. We also have our Facebook page. The link is given in the description, and you can also follow our Facebook page. Thank you, take care, and we shall see you in our next video.